Spad FM in the Savannah region, in the Upper East region, Sky FM in the Bono region. In London, it's on ABN Radio and worldwide at myjoyonline.com. Coming up, Ghana records nearly 400 new coronavirus cases, bringing the country's case count to nearly 3,100. We have details plus a surge in stigmatization.
And then they called and told me that I shouldn't come and sit with them, if not that they won't get customers. They stole my daughter.
We have details for you also this morning. Former Vice Chancellor of the University of Ghana warns controversial public universities bill could make Vice Chancellors puppets in the hands of politicians as he asks academia to oppose the bill.
I'll be hesitant to be a Vice Chancellor if every single agreement I sign...
You're afraid you're going to be a puppet?
Precisely.
Okay.
Precisely.
We'll tell you why he believes there is still a plot to rewrite his legacy at the University of Ghana after 6 years as Vice Chancellor.
In business, leadership of Abasiokai Spare Parts compile list of members affected by COVID-19 pandemic for stimulus package. We have a report ahead in 15 minutes.
We have details of these and other stories here in the package. Thank you for joining us. We're grateful you could share company with us this morning. Now, as Ghana's coronavirus case count crosses 3,000, the issue of stigma continues to worry health authorities. We'll bring you a story about a 9-month pregnant woman in the Upper East regional capital, Bolgatanga, who is facing abuse by community folk despite recovering from the disease. But first, head of the health desk, Fred Smith, joins me in studio with Ghana's latest figures. Fred, what do we know?
Welcome. Now, the number of novel coronavirus cases in Ghana has now risen to 3,091, and this represents a jump of 372 new cases from the last update we had. A new case detected in the German North District makes Bono region the 13th region to record a case. The services, the Ghana Health Services, Ghana Health Service website also reveals 303 recoveries and 18 deaths as of May 7, 2020. Here's the regional breakdown of the cases. Komla, Greater Accra region with 2,579 cases, Ashanti with 165, Eastern 95, Western North 56, Central region 50, Western region 32, Volta 30, Upper East region 26, Oti 23, Upper West region 19, Northern region 13, Northeast region 2, Bono region 1, Savannah Ahafo, and Bono East. These are the 3 regions without cases, Komla.
Thank you very much, Head of the Health Desk, Fred Smith there. Well, the fight against COVID-19 is expected to receive a boost as health officials in the Ashanti region welcome real-time data on the pandemic. It follows completion of backlog of samples for testing at the Kumasi Center for Collaborative Research. Regional Health Director Dr. Emmanuel Tinkrang says the development addresses difficulty about absence of real-time data due to uncleared samples in the laboratories. He told the press conference in Kumasi health authorities will now be adequately equipped with the right information on the pandemic.
Until now, the Kumasi Center for Collaborative Research has been the only biosafety level 3 laboratory for the northern sector. There was always backlog of cases to be cleared. At least 8,000 samples, which have been outstanding, were cleared as at Wednesday. Dr. Emmanuel Tinkran says it is welcome news.
We were working basically on how to get a real-time data for all the cases. We had a lot of backlog at the laboratories, and for that reason, we were not getting the real-time data. So now, with the support of the labs, we've been able to clear a lot of backlog. So from now, our hope is that we will get a real-time data.
Despite the success chalked, health authorities have another hurdle to clear, that is stigmatization. Dr. Emmanuel Tinkran wants all hands on deck to fight stigmatization.
Anytime we are going to pick a case, there's always a fight, and some of them do not understand, and they resort to social media to discredit what we are doing.
So you heard the Ohemi Interior's report. Let's still stay with the issue of stigma a while longer and now bring you the story of a 9-month pregnant woman in Bolgatanga in the Upper East region who is traumatized by the abuse she's receiving from community folk. In fact, her children are also not spared the wrath of community folk, even though she has been declared recovered from the virus. Here is Albert Sori's report.
A little over a month ago, a pregnant Matilda was ill. She later tested positive for the virus, becoming the first COVID-19 patient in the Upper East region. Matilda recounts her identity and the results of her coronavirus test somehow made it into the public domain.
Immediately my results also came out. Someone quickly posted my husband and I on Facebook and told them that we've run away and we are having the virus. So the whole news spread in, I can say, the whole Upper East.
This was how people within and outside the community began to stigmatize Matilda and the rest of her family.
They stoned my daughter, the community. It was dry okra they asked her to buy. When she just left the house, they started stoning her, and even mothers were sitting under their trees watching children to stone their fellow colleagues.
When Matilda recovered from the virus and was discharged from the hospital, she was also met with stigmatization.
Albert Soris report there. Let's bring you one of our headline stories, because scientists around the world are racing against time to find a vaccine or cure for COVID-19. But here in Ghana, some young people in some ghettos in Accra community of Choco believe they have found an antidote to the virus. That's weed or marijuana. This is one of many myths Joy News will highlight in our new series titled Combating Fake News Project in partnership with the Media Foundation for West Africa. Joy News' Henry Kwesi Bedu visited the ghettos and has today's episode.
There's a natural mystic flowing through the air.
When you smoke the weed, you are not going to get infected. So right now, we the smokers, we are smoking it times 20.
That's 25-year-old Aziz, who started using marijuana some 6 years ago. He only used the herb occasionally. But things have changed now. Since Ghana recorded its first case of COVID-19 in March, he has spent most of his days at the ghetto. His reason, users of cannabis are immune to COVID-19.
Before the virus, early in the morning, I take 2 rows, afternoon 2 rows, evening 2 rows. But now, from morning to afternoon, I take almost about 7 rows, evening 4 rows, making 11 rows.
We meet 45-year-old Raymond Ankuma, a resident. He tells me marijuana is now a major component of his diet, taking it thrice daily.
We the smokers are immune to this virus. If one wishes to be immune from the coronavirus like us, then just use the herbs to prepare tea and drink in the morning or in the night. That's just it. In the morning, you can mix the substance with water in a cup and add sugar. Once you do that, you don't have to be worried about contracting the virus.
You will not get the virus at all. No.
We have been speaking to Professor Alfred Yossen of the University of Ghana's Medical School, who debunks this myth.
It has not been proven that smoking marijuana will protect you from COVID. And marijuana itself has its own effect already. And now increasing the usage and excessive use of it may have more ill effect than they would wish for. The doses that are used medically are way below what they use, and then whatever elements that are contained in what they smoke can be very harmful to their body system, and especially when you are increasing the amount that you smoke every day will have ill consequences.
You heard the Henry Kwesi Bedu's report read to you. Now, former Vice Chancellor of the University of Ghana, Professor Ernest Aite, is asking Vice Chancellors of public universities across the country to unite against the Public Universities Bill, I beg your pardon. Critics of a controversial bill set to be considered by Parliament when it resumes say it will hand control of university education to politicians. Professor Aite, speaking on PM Express on the Joy News channel last night, agrees if the bill is passed, it could make Vice Chancellors puppets in the hands of politicians.
We have always been worried about ministers interfering with the way universities are run. I am worried about anybody who wants power that he or she does not have by law. Should they reject it? Parliament should reject it.
Should the Vice Chancellor's Ghana adopt a similar position to what they previously had, which is, this is not good for us?
That's what I would strongly suggest to them. This cannot be good for university education in Ghana. I'll be hesitant to be a Vice Chancellor if every single agreement I sign...
You're afraid you're going to be a puppet?
Precisely.
You heard the former Vice Chancellor of the University of Ghana, Professor Ernest Aite. Just before we go, the Bono East Regional Minister Kofi Amoako-Hene is lauding Joy News' Arrive Alive campaign aimed at providing road safety education to curb the carnage on our roads. The campaign, which has been running since the beginning of the year, has been lauded by many for the education it is providing. The latest to join is the Bono East Regional Minister Kofi Amoako-Hene, who is asking businesses to support the